rather excited about this recent, I'll call it a discovery regarding the talus. And this is more for people that have a background in treating the talus, treating the joint that the talus makes with the tibia above, which would be the ankle joint, and the joint with the heel or the calcaneus below, which is called the subtalar joint. I have had the observation that some clients, this part of their anatomy is the talus, and it looks more forward than the tibia, okay? And when I encounter that, oftentimes when I spring the foot upward, it has a bony block. It doesn't spring. And when I come and try and spring that piece of the talus, that part of the talus that's accessible posteriorly, it doesn't spring. But this is an example where Mark looks like that talus is forward. His dorsiflexion is only to about neutral, but I'm able to spring a normal end feel. And I found out maybe about 6 weeks ago that some people can have an occulted anterior talus, and it's occulted for reasons we don't fully understand. And what I found was that if I mobilize the heel, the calcaneus, posteriorly, after that maneuver, the talus then presents itself as being stuck, okay? So let me show you what that looks like. Can I have you scoot down so your heels are off the table? Okay. So I don't change, just relax. Yeah, I don't change the angle, the resting position, but I stabilize tibia. So I'm definitely above the ankle, right? And I just capture foot, and my intention is to mobilize the heel. Now, what happens with the talus? The talus is free, it's not constrained. That would be an interesting conversation to debate what we think the talus does with this maneuver. But you'll notice I can't spring in that direction. So it may be that it's lost it's come forward to an end range. So I do a little distraction, so a little bit of pulling the foot downward to try to get a little bit more joint space, okay? And then I'm going to shear it that way, okay? So here's a little bit of distraction, and then I'm gonna glide that 10 times. And it's pretty forceful. And then I'm gonna retest it, and I now have a little bit of play. I can see his heel moving. All right, so we're gonna retest the spring, and I'm gonna do the movement. Try your best not to participate. Just let me do this to you. I'm just gonna push the foot up. And so now we get passive dorsiflexion. And I know he's kind of pulling in that tibialis anterior a little bit. See if you can relax your right foot. Yeah, pull this one up. Pull this foot up. Real hard, real hard, real hard, real hard. Okay, and relax. I'd like that to be a little bit more relaxed. But anyway, let's just feed forward. So now I'm not able to get that spring, that spring into dorsiflexion, and I'm not able to, well, go ahead, scoot up. When we did it previously, the heel was on the table. I can't spring that. So I'm gonna now attempt to mobilize his talus into posterior glide, and it should move perhaps 2 millimeters in glide, and it gains 2 degrees of dorsiflexion. But I have, and that's per published research, but I have noted that if we scoop the heel downward towards my elbow and up to the ceiling, an arc, okay? So towards my elbow and up towards the ceiling, and then I slide down the foot, tighten up everything, and then, you okay?
Mm-hmm.
Is it uncomfortable?
No, I thought you asked me.
Oh, no, just relax. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then I go ahead and slide up an inch or more. And now I'm on the tibia. And then I can see if the tibia springs. And his tibia also springs, so we don't need to mobilize the tibia. Sometimes it doesn't spring, and I will oscillate the tibia 10 times. Okay? And then I also test tibial passive internal rotation, which is sometimes in need of restoration. Okay? So now I'm going to test his dorsiflexion again. And he has gained 10 degrees easily. And there's bounce now. Can we keep filming? And you don't need to film him. I'm just going to walk down the hall and come back and tell us how he feels. So can you go ahead and do that? Take a walk. And yeah, feet used to intimidate the heck out of me. So complicated. But they're really fun to treat. And there's some good data out that affirms what we see clinically, that there are reflex connections between the foot and the head and the neck. And I have a dramatic case of helping someone with severe 5-year-long headaches by freeing up hips and feet. Give us some feedback.
It's definitely looser, more fluid in walking.
Okay.
On the right side.
Okay.
It's almost like the left side could use it too, like that joint in and of itself.
I'm in agreement.
Okay.
It's next.
Okay.
So again, just to review this, I'm suggesting that he had an anterior glide and plantar flex talus with reduction of dorsiflexion range of motion, but I was able to spring it. Somehow it was occulted, and after I restored posterior glide, primarily of calcaneus, but you know, that maneuver might glide talus with it. I don't think we know that. I don't think we have an answer to that. That would be a great research inquiry. After that, then dorsiflexion became blocked, okay? And so then I scooped the calcaneus, so towards my elbow, okay, traction those two joints, and then scoop it up to the ceiling, and then with my other hand, glide posterior, so create a very tight force couple. And he gained. He was at neutral, and he's now like there. It's 10 or 15 degrees of dorsiflexion. So that's a recent discovery that I've made clinically, and I'll search the literature and see if that's described somewhere. I rather doubt it. I don't think we're going to find that pattern described. And I contemplated, you know, treating that through the tibia. And I surmised that in sitting, if I put my left foot forward 6 inches, then my foot is in that same relaxed posture as when he was laying on his back. And rather than me gliding the heel and the foot backwards, I asked myself, could I capture the back of my tibia, my distal tibia, and glide it forward? And I was at a doctor's office, and I did it for 5 minutes. And I did it on both sides. And I have forever had people work on my ankle to make sure my dorsiflexion was optimized, and treated it myself. And I've even done this, thinking that, you know, with dorsiflexion and with my heel digging into it, that I'm restoring posterior glide and some of that dorsiflexion rotation of the talus. But I always felt that my knees needed more extension. And I've had 2 total knees, and I still have patellofemoral pain. Not as severe, but it can be significant. after I did this, I stood up. It's like, oh my God. My knees feel like they are in normal extension now. And that was easily 4 weeks ago. So it's lasted that long. And so I'm still contemplating it. I haven't had time to dig deep in the literature again. It's been a few years since I've done a deep dive in foot and ankle. But for me, it definitely had clinical utility. I mean, I am standing and I know my knees are in a different place than they've been for certainly since 2020 and probably long before that. So it's again, this video is for foot geeks, you know, biomechanical geeks, and being a biomechanical geek can be a good thing for some. Thank you.